it's Dr. Wendy Fortna with this week's update on the COVID crisis as it pertains to Hana and area residents. So thank you to everyone who submitted questions to me. I will tell you that some of them were of a very personal nature regarding people's symptoms or symptoms of their family and friends, and those are not the kind of questions that I can comfortably answer on a video like this, but hopefully those of you who did submit those ones received a phone call from one of our nurses here at the clinic to help you manage your particular circumstances. So I'll start with the questions as we have them. My first one was, how many tests have been done on special areas residents, or do you have that information? And the answer is I don't have that information. I can tell you that because the initiative was for people to phone 811 and get directed to what we call an assessment center, very few tests are actually done in the Hana area by the physicians or nursing staff here. Right now, we are only testing as physicians people who are sick enough to be admitted to hospital, or people who end up in our offices for some other reason. So I can't tell you for sure how many, only that they have all come back negative from the special areas at this time. The second question I got is, when is Hana expected to get the peak number of cases? Because we have been advised that we're going to have 8 to 12 weeks of social distancing. So because we don't have any cases in Hana, we can't create a model based on data of any sort in our area. Our model is based on Central Zone out of Red Deer, where we do not have that many cases, and in fact, we're considered to be about 2 weeks behind both Edmonton and Calgary. So with that data, the best approximation that we can get is mid to late May is when we expect to have the peak number of cases requiring hospital care in our area. If our social distancing measures work well, that's exactly what we're going to see. If they are not working so well or we're not compliant with them, then we might see a spike earlier in the month of May. So all of the work that we're putting in now, both in the community by yourselves, as well as in our hospital, is to try to make sure that we get that peak at the end of May and that it's a slower peak. We don't want a really steep one because that's when we're going to run out of our resources. So right now we're on track for being in control and having the peak number of cases at the end of May. Another question came up that was a really, really good one. If you have been isolating because of illness, which you all should be doing for the 14 days, it's been shifting between 10 and 14. So we'll say 10 days is now the current guideline if you have infectious symptoms such as a runny nose, a cough, a sore throat. What do I do if my symptoms last longer than the 10 days? The answer is you have to stay in isolation. Because we don't know whether or not you have COVID and we don't know whether or not you are infectious with it, you are required to stay in isolation until the symptoms of your illness resolve. There are some instances where people will have something called a post-infectious cough, and if you think that might be the circumstances for yourself, I would want you to contact the medical clinic so that one of the doctors could discuss your case personally. But the general guideline is that you stay isolated until the symptoms of your illness resolve completely, or 10 days, whichever lasts longer. A really nice one here. Will the clinic be able to stay open? Right now, all 4 physicians in Hana are healthy, and we're offering services including our phone visits, our home visits, and for people who need to be seen in person, visits here at the clinic. We do anticipate that either, one of us or even 2 or 3 of us could become ill with COVID ourselves at some point. And so we do have plans that the clinic will continue to offer services. Although if it gets really bad, it might not be your family doctor who's actually helping you with your health issues. It could be one of the other doctors here in our clinic. But right now we have contingency plans in place that the clinic will be able to do all non-emergent health care, including things like prescription refills and small lumps and bumps and health issues. Make sure you call us ahead of time to find out what type of appointment is the most appropriate for your needs. Next one, I like this one. What works to clean the virus? So the wipes that you see in the grocery stores are excellent, our Lysol wipes or Clorox wipes. If you don't have access to those products because they're sold out in many places, if you have a good old-fashioned container of bleach, you can mix 100 milliliters of bleach with 900 milliliters of water, and you can use that solution to safely sanitize things within your home environment. The next one, is there any way to determine if you have had the virus and recovered from it? Right now, the answer is no. We presume that people who have had COVID disease do have immunity for a period of time, but we are not testing people specifically for that immunity. Previously, when people had been infected with a confirmed swab positive, we were doing repeat swabs to confirm that they are now negative. Right now, we are not doing that in the community. We're presuming that immunity and infection resolution happen at about the same time. So I have no way to tell you if that cough or cold that you had at the beginning of March was in fact COVID or not. That may change in the future, but for now, we don't know. Another one here, why are swabs not being done in Hana? Well, that's a hard one because they are being done in Hana, but only in certain circumstances. So the biggest change that happened recently is that anyone over the age of 65 who has symptoms including cough, runny nose, fever, sore throat is eligible to have a COVID test done. These tests are being coordinated through 811 service, and people are being sent to what we call assessment centers, which are places in Red Deer and in Camrose where that is all they are doing is swabbing people either in their vehicles or through other means to try to stay as safe as possible. If people are deemed needing a swab but are unable to travel to these locations, then swabs are managed for them in their home community or at least closer to their home community. We want to have distinct sites doing these tests, both to maintain the safety of the healthcare providers doing them, in order to also save the protective equipment by not having to change gowns, for example, between every set of swabs that are done. As well, we want to make sure that we're properly doing something called contact tracing. If we are swabbing you, we want to be able to track who you had been in contact with for a few days prior and during the beginning of your illness to make sure that we're not missing anybody. Here in Hana, we are swabbing patients who require our hospital because they obviously cannot travel comfortably out of our community. That is primarily who we are swabbing here. But do not fear, if you are eligible and require a swab and cannot travel to an assessment center, there are ways to get you swabbed closer to home. They're just not the ideal option for us. That's all the questions that I had for today. So,
green sleeve.
Sorry, someone just told me I needed to remind you about green sleeves. We had asked you last week to please discuss your goal of care with your family doctor where you can prior to potentially being in the hospital with infection. If you do not currently have a goal of care at home and you are over 65, I would strongly encourage you to book an appointment with your family doctor to discuss over the phone what a goal of care means and other types of planning, including things like personal directives and power of attorney, really important documents to have on hand. So I think that's it for now. I hope everyone stays well, stays healthy, and I'll see you next week.